Hello everyone, welcome to Medteach. Today we are going to discuss one of the interesting topic, eating disorders. Eating disorders are serious mental health conditions that involve unhealthy relationships with food, body image and weight. They can affect anyone regardless of age, gender or background. There are four types of eating disorders. The first one is anorexia nervosa. What are the features of anorexia nervosa? There is an intense fear of weight gain and distorted body image. And because of this, the patient will have severe calorie restriction and her BMI will fall below 18.5 kilogram per meter square. In anorexia nervosa also, there are two types, namely restricting type and the another one is binge eating or purging type. In the restricting type, there is no such binging or purging, whereas in binge eating or purging, patients sometimes does that binging or purging. Okay. What are the complications in anorexia nervosa? Patient can have bradycardia, hypotension, hypothermia, hair, and osteoporosis. And patient will also experience amenorrhea episodes because of reduced leptin, there is reduced GnRH hormone that will be further reducing the gonadotropins, namely the luteinizing hormone and the follicle stimulating hormone, and there is also reduced estrogen. And because of this, if we suddenly increase the calories, what will happen? She may end up in refeeding syndrome. So, what will happen in refeeding syndrome? There is sudden increase in calories that will increase the insulin and which is going to again reduce the phosphate, potassium, and magnesium, and that is going to cause cardiac and neuro issues. So, treatment should include nutritional rehabilitation, psychotherapy, and drugs like olanzapine can be used. Now, coming to the second disorder, that is bulimia nervosa. The features in bulimia nervosa includes recurrent binge eating plus compensatory purging that can occur more than a week, many times in a week, and more than 3 months continuously. Normal or slightly high BMI can be there in patients with bulimia nervosa. Complications will include parotid gland hypertrophy, increased amylase, enamel erosion, and Russell sign, which is nothing but knuckle calluses. And these patients will also have electrolyte imbalances like decreased potassium, decreased chloride, and that will be resulting in metabolic alkalosis. Mallory phase tears means Mallory phase tears or longitudinal mucosal lacerations in the lower esophagus or the upper part of the stomach. Typically, that will be caused by forceful or prolonged vomiting or retching. Treatment will include psychotherapy, nutritional rehabilitation, and SSRIs for patients with bulimia nervosa. And in this case, we have to avoid bupropion because that will cause increased seizure risk in these patients. Now, coming to the third type of eating disorder, that is binge eating disorder. In binge eating disorder, there is recurrent binge eating without purging, and it will occur many times weekly for more than 3 months. It often leads to obesity, and there is increased risk of diabetes as well. Treatment will include psychotherapy, which is the first line of treatment, and drugs like SSRIs can also be tried. The final type of eating disorder we are going to discuss is the PICA. There is persistent eating of non food substances like ice or dirt for more than 1 month. It is seen in children also, and it is increasingly seen during pregnancy and also pathological conditions like iron deficiency anemia, trauma, or developmental disorders. Treatment will include psychotherapy and nutritional support, and SSRIs can be used as a second line. Eating disorders are most commonly seen in adolescents and young adults, especially teenage girls and young women who are in the age group of 12 to 25. This group shows the highest prevalence, particularly for anorexia nervosa and bulimia nervosa. Cultural pressures, social media, body image concerns, and hormonal changes can all contribute. Young men while less frequently diagnosed with eating disorders. In men, they are often underreported. Men may be more likely to have muscle dysmorphia, that is, obsession with being muscular or being binge eating disorder. People with certain risk factors, like athletes, especially in sports, emphasizing weight or appearance, for example, people who are more interested in gymnastics, wrestling, and ballet, can also have. Then, LGBTQ individuals, particularly those facing stigma or identity struggles, are also prone to these eating disorders. And also, it is seen in people with a history of trauma, anxiety, depression, or obsessive compulsive disorder, and those with family history of eating disorders. I hope we have interested such an interesting topic and you have learned something about eating disorders. Thank you for watching the video. Stay tuned with Medteach.